Hi, my name is Professor Atkinson from Mechanical Engineering at Kettering University in Flint, Michigan. And I'm here today to talk about how we can develop an entrepreneurial mindset in our science and engineering students, and how we can get these kids to become entrepreneurs within their organizations. Now, I happen to work in the healthcare industry dealing with medical products, and that's a highly regulated sector. This is not too different to what occurs inside of the automotive industry, which is also, of course, highly regulated, with things, for example, such as safety.
So here we are with our overall project that we deploy in the classroom, and the idea is to go from an idea by identifying an opportunity all the way up to a product that could actually be used in a hospital. And how do we go about? We start by teaching students to think like an entrepreneur. The students of today, of course, are the industry leaders of tomorrow. And entrepreneurial thinking is a little scary for some of our students because it typically involves a lot of risk. So another idea that's related to that, but is a little more comfortable for some of our students, is to be an intrapreneur. That is, to be somebody who takes on and tackles big ideas and big projects within the safety and security of a company that provides them a weekly paycheck, versus the entrepreneur who maybe is kind of out there on his or her own. And one of the things that we need to impart to our students is they need to be flexible, because their initial idea may have to change and get revised to make sure it meets all of the different requirements that they come to along the way. For example, it needs to meet government approval. And they also want to stay true to the intent of their concept. So trying to make sure it's going to get approved by the government and it still stays true to their original intent is one of the challenges. And it's a balancing act. You don't want to go all one way or all the other way. Sometimes you have to find the middle way. Here's an example. Suppose you want to design tomorrow's awesome new hip joint replacement. And if you want to make it out of titanium, no problem. Turns out titanium's got a lot of great properties, but besides that, it's been in use for many years and has a great track record in humans. And so to get that approved is actually relatively easy. Suppose, however, you wanted to make a product that is also for the bone. This happens to be replacing a part of the skull, and you want to make it out of magnesium. There's a lot of really good technical reasons why magnesium would be an excellent material to study. However, there's no track record, and so it would take you a long time and many dollars to prove to the FDA that it's safe, because there's no history there. And just in round numbers, I kind of throw out ballpark, you're looking at maybe 10 years and $100 million. So maybe that's something you want to avoid. Maybe it's something you want to jump in with both feet. You have to make that decision. Here's how we more specifically design the course. We want to get kids inspired in the classroom and aware of some of the issues that surgeons deal with. Now you might think, well, what about the patients? Yeah, the patients is part of it, but a medical product is typically decided upon by the physician. So we want the students to understand what the physicians are going through. And so we have a series of surgery simulations our students do in class, and we encourage you to check out our YouTube channel. It'll walk you through the whole process. Now we need to identify different strategies to determine what opportunities may exist. A great place is to think about what you know, personal experience. We've all been sick or been injured or had problems. It's a great starting place. Networking. You might know a nurse or a physician or a dentist. All of those are great people to talk to. You may be aware of an existing product that could maybe be improved, could be refined, or maybe you could use it as a jumping off point and go in a new direction. And finally, something called the grid, where you look at a group of different types of people, for example, elderly, infants, etc. You look at different types of technology, for example, gaming, 3D TV, etc. And you look at where maybe there's an intersection between a certain type of technology that has not been applied to elderly. As an example, look at wireless and elderly. In that case, if somebody falls at a nursing home, they have somebody there to help them. If they fall at home and they live alone, they may be in trouble there because nobody can help them out. By having those I've fallen and I can't get up type products, it allows that person to be safe. So the grid is a great way to find new opportunities that you may not have considered in the past. And then after the students have their opportunity identified, they pitch it to a local physician who gives them feedback from both a medical community point of view and also a patient point of view, because they can typically anticipate what their patients like and what their patients don't like. Now once you have your idea kind of figured out and the physician has given some feedback, so you've been allowed to refine your idea, you now need to protect your intellectual property or IP by drafting a one-page patent. And here you see an example right there. You also need to make sure that you can get this thing approved by the Food and Drug Administration. A lot of us have heard of 401ks. Well, there's a similar thing in the drug device and medical area in which there's the 510K. It's the paragraph and section of the Food and Drug Administration Act that deals with approving new devices for use. And then you also have to show the federal government that you have a way of manufacturing and producing your product reliably and safely. And that typically involves you achieving some kind of approval through ISO 13485. And finally, you'll do a final pitch to the physician and show that you've got all of these things ready to go, and now you're ready to go to market. And that's essentially the process from start to finish. Hope you've enjoyed this video, and we thank you for watching.